Hi everybody and welcome back to my channel. I would just like to take a moment to thank all of you who've been watching my videos. I really appreciate your time and support. For those of you who are new here, my name is Kavana. I'm a psychologist and I usually talk about mental health, psychology and neuropsychology related topics on this channel. Today I want to talk about the process of therapy. So, if you're someone who's curious about what happens in therapy, or if you're planning to take therapy for yourself, keep watching this video. Let me start by saying that a lot of the times the therapy or counseling process that we see in TVs and movies do not correctly depict what actually happens in therapy in real life. That is why it's important to understand what goes on in the process of therapy so that you can set your expectations right before entering therapy. Please also excuse my setup today. It's a little different from my usually setup. It's because I'm feeling a bit under the weather. Now, without further delay, let's get into the topic. Just like any process, the process of therapy also has a start, a middle, and an end. The first part consists of understanding the relationship between the therapist and a client, building the relationship and understanding the concerns. The second part consists of majorly working on these concerns, and the third part is obviously termination of therapy. Let's look at it one by one, starting with the first phase of therapy, which is to understand the client and build a relationship with the therapist. The therapy process starts with rapport building. This means that the client should be able to trust the therapist with their deepest, darkest concerns. Once the rapport is established and the client feels like it's a safe space to talk about his or her problems, the therapist starts exploring the complaints or the concerns that the client is presenting. This could mean exploring any recent problems, any recent events that took place, or any traumatic events in the childhood or past that may have happened. The therapist also tries to understand the strengths of the client at this point, to understand how they've been dealing with these problems so far, which leads to assessing the problems. Now, talking to a client is just one way that a therapist can assess what is wrong. Different tools like tests, self-reports, quizzes, observation is required while assessing a person with a particular mental disorder. In certain severe cases like schizophrenia, bipolar disorder, and personality disorders, reports from family members are also collected. It's important to understand that a diagnosis may not always be required. Based on the severity and duration of the symptoms, the therapist may choose to diagnose or may not. Even in cases where there is no diagnosis, it is not a problem at all. The therapist and the client do set goals to work towards and improve. The therapist, along with the help of the client, set certain goals that they can start working towards. Which brings me to my next phase of therapy, which is actually setting goals and working on these concerns. Setting goals is a very important aspect of therapeutic process because it gives a certain direction to the therapist and the client. All the conversations and the skills learned in therapy is directed towards reaching that goal. Now, based on the problems of the clients, the goals that are set, and the strengths of the clients, new skills are learned. If the client has relationship problems, maybe skills like communication skills, emotional management skills are learned in the therapy room. The skills that are learned in therapy is not just limited to the therapy room. In fact, the most important aspect of therapy is to take the skills that are learned in the therapy room and apply it in real life. So if a client has learned how to regulate or manage his or her emotions in a healthy manner, they actually have to try these skills out in the real world with the people around them. Of course, it does take time and a lot of practice to master these skills. Which brings us to the next phase of therapy, which is monitoring progress and terminating. So now, based on whatever skills that the client has learned and is using in real life, the progress is monitored. This means looking back at all the experiences and understanding if these skills are actually helping out. In a lot of cases, they do work, but in some cases, when these skills do not yield the expected results, the therapist does make modifications in the skills as well. For example, if a client who's learned emotion regulation in the therapy room and is practicing the same in real life but is not seeing the results, can come back, monitor their progress, and tell the therapist that, okay, this is not working out for me so far. Based on this, the therapist may try to explore more on why this is not working out, or give him or her some other strategies that might work. Now, there may be chances that there are a lot of trial and error along the way in therapy, and that is completely fine. The point is to stay patient. Every skill that doesn't work also teaches us something about ourselves. This is why therapy is considered to be a gradual and a slow-paced process, a journey almost, which requires a lot of patience and time and efforts. Of course, after a few sessions, when the goals are met, the process of therapy can come to an end. This is usually called termination of therapy. A lot of the time, clients also tend to develop a lot of stress and anxiety around termination because of this feeling that they're losing a source of support. But this is nothing to be scared of. Every counselor, therapist, or psychologist do practice keeping follow-up sessions. This could mean you can get in touch with your therapist even after termination. These are usually called follow-up sessions or booster sessions. It's also important to know that a lot of the symptoms may tend to recur. This is called as relapse. This is why it's always suggested or advisable to stay in touch with your therapist even after termination. I hope that this information was useful, and even if it helps one person to go seek therapy or talk to a professional, my job here is done. I can't emphasize this enough, how important your mental health is. So please take care of yourself, take care of your mental health, and talk to somebody if you need to. With that, we have come to the end of today's video. Thank you so much for listening to me and staying till the end. Make sure to check out my social media, Psychology with Kavana, on Instagram. And if you have any other topics related to mental health, psychology, or neuroscience, let me know in the comments, and I will talk about it in my next video.